Ah, the NHS. Born in 1948, swaddled in idealism, and raised on tea, toast, and 10-hour shifts. It was a crown jewel of post-war Britain. A promise that no one would suffer for the lack of money, only for the lack of beds. And Ian Bevan, the fiery Welsh miner turned Minister of Health, birthed the NHS with a mix of socialist zeal and political cunning. He famously said he had to stuff the doctors' mouths with gold to get them on board. Today, we stuff their inboxes with bureaucracy and hope they do not notice the pay cuts. The NHS was meant to be free at the point of use. What's more, it is, unless you count the cost of waiting. Waiting for an appointment, waiting for a scan, waiting for a bed. It is less a health service and more a national patience test. Over the decades, the NHS has survived every government's attempt to modernise it, which usually means rebranding departments, inventing acronyms, and hiring consultants who charge £500 an hour to say, "You need more nurses." There have been internal reviews, external reviews, strategic frameworks, and digital transformation plans. We have merged trust, split regions, and created integrated care systems that do not integrate or care. Furthermore, through it all, the NHS soldiers on, underfunded, overworked, and heroically British, say many. Nevertheless, let us not romanticize it. The NHS is in crisis. Staff are leaving, patients are waiting, buildings are crumbling. Not only that, but politicians are blaming, well, everyone. But do please watch my previous video, The History of Blame, Britain's favourite sport, and make up your own mind. However, the pandemic exposed the cracks, and instead of filling them, we painted over them with slogans. Protect the NHS, build back better, levelling up. Meanwhile, private providers circle like vultures. Outsourcing is the new normal. GP surgeries run by hedge funds. Mental health services managed by spreadsheets. Dentistry? Good luck. It is now a luxury item like avocados or honesty. Yet, the NHS endures, like a stubborn pensioner refusing to retire. It is the last bastion of collective care in a country increasingly obsessed with individualism. It is where ideology meets reality and where slogans are tested against suffering. From the polio vaccine to robotic surgery, the NHS has delivered miracles. It has treated kings and paupers alike. It survived recessions, reforms, and the occasional health secretary who thought Excel was a clinical tool. The NHS is not just a service. It is a symbol of what Britain once aspired to be: fair, compassionate, and slightly chaotic. If we lose it, we lose more than healthcare. We lose a piece of ourselves. So let us stop treating it like a political football and start treating it like a national treasure. Because if the NHS dies, it will not be from disease. It will be from neglect. And that, my dear viewers, is a diagnosis Britain cannot afford. Goodbye.